we are going to explain for you intrinsic fibroelastic membran or ligament. One of them is visible here. If you remember in this picture, what was the name of this membran or this ligament? Conus elasticus, cricoid ligament or membran. And I told you we can use another name for this ligament. If I make a surgical section from this picture, is going to remember you that we can find some membran, such as the cricoid membran. This cricoid membran inferiorly is going to attach to superior border of arm of the cricoid, and superiorly, anteriorly it is going to attach to posterior surface of thyroid cartilage, and the posteriorly it is going to be continue to the vocal process. So this part, this superior free border of this membran that the name is cricothyroid membran, we can call cricovocal ligament. I'm going to repeat. Please pay attention. Between the cricoid and the thyroid cartilage, we have a membran. What's the name of this membran? We call cricothyroid membran. If we prepare a surgical section from the larynx, so I am able to show you and explain for you this picture. In sagittal section, we remove one of the lamina of the thyroid cartilage. So I am able to show you the cricothyroid membran or cricothyroid ligament. This cricothyroid membran inferiorly attached to superior border of the cricoid cartilage, and superiorly it is free. Anteriorly, this free border attached to the thyroid cartilage, and posteriorly it is going to be attached to the vocal process. The free superior border of this membran we can call cricovocal ligament. We can call cricovocal ligament. Okay? It is going to form for you the true vocal cord. It is going superior to form for you three vocal ligament, three vocal cord. Okay? You are in an exam. I ask you, the vocal cord or true vocal cord are going to be a part of which of the following ligament or following membran or following structure? It is a small portion of this fibroelastic membran. What's the name of this fibroelastic membran? Cricothyroid membran. Superiorly, it is free between the posterior surface of the thyroid cartilage and the vocal process. This part is free, and it is going to form for us the vocal ligament. The vocal ligament. So true vocal cord or vocal ligament depends to which fibroelastic fascia membran? Cricothyroid ligament or membran. Do you have any question here?
It belongs
No.
to the glycol?
Here
It belongs to the what?
belong to this membran, to this ligament. What's the name of this ligament? Cricothyroid membran or ligament. Now, you imagine that the vocal ligament, that the true vocal cord is going to attach to the vocal process, and we know the posterior cricoarachnoid muscle is going to attach to muscular process. When this arachnoid cartilage rotate laterally, what happened? The vocal ligament abduct, go far from each other. If you imagine, this is the arachnoid, vocal process and muscular process. The muscular process, one of them is going to attach here. We know the vocal process is a process that the vocal ligament attach here, for this side here. So when this arachnoid rotate laterally, means two vocal ligament abduct, go far from each other. Okay? Can you imagine? Now, another intrinsic membrane is here, and we are going to speak about that. What's the name of this? You know this. The cricothyroid membrane or ligament. Here is a vocal cord, and if I change the picture, in this picture, I am able to show you another membrane. This membrane, if you notice, we can call quadrat membrane. Quadrat membrane, the position compared to the cricothyroid membrane, the position is inferior or superior? Superior. Above this quadrangular membrane, if you notice the inferior free border of quadrangular membrane, it is free between the arytenoid cartilage and the thyroid cartilage. This is going to make for us the vestibular ligament. So the vestibular ligament or false vocal cord belong to inferior free border of quadrangular membrane. Look at the picture. Again, I am going to explain for you. It is a surgical section. We remove half of the larynx. In this picture, you are able to look at to the epiploid, you are able to look at to cricoid, and you are able to look at to thyroid cartilage. Here is the arytenoid cartilage. Okay? This is the vocal process, and here is the muscular process. You know the name of this membrane. It is cricothyroid membrane. What's the name of this membrane? We can call quadrangular membrane. About the cricothyroid membrane, the superior border is free and is going to make for us the vocal ligament. What's the another name of the vocal ligament? True vocal cord. True vocal cord. Another membrane in the structure of the larynx we call the quadrangular membrane. The position of quadrangular membrane is superior to this cricothyroid membrane. Above the quadrangular membrane, the inferior border is free. So we can call vestibular ligament or false vocal cord. False vocal cord belong to which membrane?
Quadrangular.
The true vocal cord belong to which membrane? Cricothyroid. About the vocal cord, it is going to form by the superior free border. About the vestibular cord or vestibular ligament, it is going to be formed by inferior free border of the quadrangular membrane. Now about the quadrangular membrane. This quadrangular membrane anteriorly attached to the thyroid cartilage, posteriorly attached to the arytenoid cartilage. Superiorly, it is going to attach to lateral border of the epiploid cartilage. So the quadrangular membrane is going to attach to the epiploid, anteriorly attached to the thyroid cartilage, posteriorly it is going to attach to the arytenoid cartilage. Which part of the quadrangular membrane is going to form for us the vestibular ligament? Inferior. The superior border of the quadrangular membrane is free. The superior border of the quadrangular membrane is free. It is between the arytenoid and the epiploid. We can call fold. This ariepiglottic fold is going to form for us the lateral side of the inlet of larynx. If you remember the last or previous slide, I show you the pharynx. In the pharynx, I show you the inlet of the larynx. If you remember this picture, it is the larynx. Here is the opening of the larynx, inlet of the larynx. To be able, the inlet of the larynx to be closed, this epiglottis go backward and downward. Go down and close the inlet of the larynx. When you are breathing, so it is different when you are swallowing. During the swallowing, when the food is passing here, the epiglottis is going backward and downward to be able to close the inlet of the larynx. Okay? During the swallowing. When you are breathing, no, the epiglottis is this position and the inlet is open. Okay? When the inlet of the larynx is going to be closed, swallowing. Now, this fold, look at here, it is epiglottis. Here is the apex of the arytenoid. We can call to this fold the ariepiglottic fold. The ariepiglottic fold in both sides are going to show you the lateral boundary of the inlet in the larynx. Ariepiglottic fold are going to participate to form the inlet of the larynx. Is it correct if I explain for you that the epiglottis also is going to participate to forming of the inlet of the larynx?
Yes.
Yes. So the epiglottis and two folds that we can call ariepiglottic are some structure in peripheral part of the inlet of the larynx. Now, we come back again. To this picture. Here, it is going to show you one of the ariepiglottic fold. It is going to be formed by which part of the quadrangular membrane? Superior border or inferior border?
Superior.
If you want to choose or prepare some MCQ question, here you are able to prepare so many questions. Okay? Please prepare by yourself or yourself. And in your exam, you are going to read this MCQ that you prepare by yourself. For example, about the quadrangular membrane, about the cricothyroid membrane, about the vocal ligament, about the vestibular ligament, about the ariepiglottic fold, about the inlet of the larynx. Okay? You can prepare a lot of questions. Now I change the picture. Look at this picture. It is going to show you the larynx, the lumen of the larynx. To be able to show you the lumen of the larynx, we remove we remove this quadrangular membrane. To be able, we remove this part to be able to show you this arrow. This arrow is going to remember you the lumen of the larynx. What do you think? It is the articular surface in the cricoid cartilage. Which cartilage is going to make joint here? Which cartilage is going to make joint here with the cricoid?
Thyroid.
Which part of the thyroid?
The horn, the inferior horn.
Is coming in this side to make joint with the cricoid. What's the name of this membrane?
Cricothyroid
membrane. What's the name of this membrane? Quadrangular membrane. Which part of the quadrangular membrane is going to form for us the vestibular ligament? Which part of the cricothyroid membrane is going to form for us the vocal ligament.
Larynx
Superior.
Superior. Now here it is the arachnoid. Which process?
Vocal process.
Which process?
Muscular process.
It is the anterolateral surface. It is better, not only anterior. It is better you call anterolateral surface. This anterolateral surface with a crest consists of two areas, superior and inferior. Now look at the picture. When you are going to pass a laryngoscope, have you ever heard the laryngoscope? When you want to look at the vocal ligament or vestibular ligament, you pass a laryngoscope to the mouth to be able to look at to the ligament, to the vocal ligament. When you are going to look at to the vocal ligament, we have four vocal ligaments. Yes, two vestibular ligament and two vocal ligament. Two vestibular ligament and two vocal ligament. When you are going to look at superiorly, you are able to look and find all of this. Because they are not this, such as this, they are such as this. Means the vestibular ligament
Lateral.
are far from the midline, but the vocal ligament are near the midline. So superiorly, when I am going to look at to the vocal cord, false and true, I am able to find and look at to all of these four vocal ligaments. Because the vestibular ligament, the position is superiorly and laterally. The true vocal ligament are inferiorly and medially. So this position helped to me with the laryngoscopy. With the laryngoscopy, I be able to look at all of these ligaments.
So they are oblique, right? Like oblique.
No, here. From superiorly, I'm going to show you in the other picture. Look at here. What happened? The vocal ligament attached to vocal process. But the vestibular ligament is going to attach to the superior area of the surface. So when the vestibular ligament attach here, compared to the vocal ligament, the vestibular ligament are far from each other, but the vocal ligament are close to each other. Okay? So the false and true vocal ligament, both of them posteriorly are going to attach to the arachnoid cartilage. Only the surface of attachment is different. The true vocal ligament or cord attached to the vocal process, but the vestibular cord or the false vocal ligament are going to attach to the anterolateral surface of the arachnoid, to the superior part. So during the laryngoscopy, during the passing of the laryngoscopy, we are able to look at to all of the vocal true and false ligament. It is during the laryngoscopy. Look at here from superior, we are going to look at to the larynx. These two ligaments are near the midline. What's the name of this ligament? Vocal ligament. What's the name of this ligament? Vestibular ligament. The vocal ligaments are close to each other. The vestibular ligaments are far from each other. During using the laryngoscope, we are able at one time to look at to the vocal ligament, true and the false, because the position of the vestibular ligament is laterally, the position of the vocal ligament are close to each other, near the midline. Do you get that? Now we go to the another part. In this picture, you are going to look at to the inlet of the larynx. If I ask you which structure are going to participate to form the inlet of the larynx, remember the epiglottis, remember the epiglottic fold, and posteriorly you are able to find a notch. This notch is between the left and right arytenoid cartilage. So we can call interarytenoid notch. Interarytenoid notch. Look at here, inside of the epiglottic fold, in each side, I am able to show you two tubercles. One of them belongs to the corniculae and one of them belongs to the cuneiform cartilage. At the apex of the arytenoid, we are able to show you the corniculae and the cuneiform. These corniculae and cuneiform are going to be found inside of the epiglottic fold. So inside of the epiglottic fold, I am able to show you two tubercles. One of them belongs to the corniculae and one of them belongs to the cuneiform. Now, in the other picture, we cut and open the lumen of the larynx. Here is the inlet, and here is the true vocal cord. Here is purple color. It's going to remember you, this green color is going to remember you the first vocal ligament, and this purple color are going to remember you the true vocal ligament. So true vocal ligament, the position is inferior compared to the first vocal ligament. Now, inside of the larynx, we have three areas. An area is here that we can call vestibule. If I ask you where is the vestibule, you should remember superior, the vestibule is going to be bounded by the inlet of the larynx, and inferiorly, the vestibule is going to be bounded by the first vocal ligament or vestibular ligament. This area we can call middle chamber. This is the middle chamber, vestibule, middle chamber. You explain for me, where is the middle chamber? Between the false vocal ligament and the true vocal ligament. This small area we can call middle chamber. And this middle chamber in each side make a diverticulum, make a sinus dilated to be able to form for us the ventricle. Form for us the ventricle. Each ventricle, if you imagine here is ventricle, each ventricle is going to be continue in each side to a socket that to the fold of the tissue that we can call saccule. Means, if you imagine, here is the false vocal ligament, and here is the true vocal ligament. This space we call the middle chamber. This middle chamber superiorly bounded by the vestibular fold, inferiorly by the vocal fold. This middle chamber in each side is going to dilate it and make the ventricle. It is a diverticulum, it is a recess. Each recess, each ventricle, it is going to be continued to a fold of the tissue. Here we can call saccule. Saccule, and here is ventricle. And inferior to the vocal cord, here we can call infraglotte region. So about the region of the larynx, how many regions we have in the larynx? Vestibule, middle chamber, infraglotte. Infraglotte is inferior area compared to the through vocal cord. There is the middle chamber between
Between
the
the
true
false.
and false. There is a ventricle in each side of the middle chamber. There is a vestibule between the false vocal cord and the inlet of the larynx. Do you get that?
Yes.
This is the subpool here. What's the name of this ring? Fibroelastic
Subpool?
membrane. Quadriangular membrane. What's the name of this membrane? Cricothyroid. Cricothyroid membrane, quadriangular membrane. Okay? You know, inferior of the quadriangular membrane is going to form for us the vestibular cord, the superior margin of the cricothyroid membrane is going to form for us the vocal cord. Okay?
Yes.
This subpool is visible here. It is possible the number, the size of the subpool vary in the paper. Okay? It is possible in some of us we have 3 socks, 2 socks, 1 sock, and in another we don't have or a small sock. These socks are going to help to the people to be able to have a good voice, because the air is going inside of the subpool and they are going to come out gradually. When you are going to sing in song, you need a structure, a good structure, a strong structure in the larynx. The number of this subpool is going to help to the people, okay? Because in this people, with the number of the subpool means the air is going inside of the subpool, and when they are going to sing in song, they are going bringing the air gradually outside and make a good sound, a good voice. Now here, we are going to look at in laryngoscope superiorly. Look at here. I'm able to show you the vestibular ligament, the vocal ligament. During you are speaking, or during you are swelling, or during you are breathing, this space is going to vary. When you are going to deep breathing, these vocal ligament cord go far from each other to be able to open the larynx. When you are speaking, the vocal ligament come near to each other, close to each other, and the air is passing and vibrate this and making sounds for you. When you are swelling, both of the vocal ligament are close to each other, the vestibule is closed, the inlet of the larynx also closed during the swelling. When the vestibule or the vestibular ligament or vocal ligament are far from each other,
When breathing.
breathing, because you need to pass the air. Okay? Now, this passing of the air is going to help to go to this air go to the lung. Now, when you want to speak, what happens to this vocal ligament? They close to each other, and the air is passing
And vibrates
making,
the
yes,
vocal.
vibrate them. Now, if somebody has problem and he cannot breathe normally, something coming and close superior or upper part of the respiratory system, you are going to do the tracheostomy. Yes? You are going to cut the trachea, or you are going to cut the cricothyroid membrane to put a tubule here for temporary period and take this patient to the emergency. Okay? When you are going to do the tracheostomy and the patient has this tubule here, he or she is not able to speak. Why?
Because
Because
there's
the
no
air is
vocal
not
cord.
passing to vibrate. Okay? You are going to do the tracheostomy inferior to this vocal fold. So superiorly, you don't have passing of the air, and the vibration of this vocal cord is not going to be happen. What's your question?
I forget it.
Instead of doing that, can't we put a tube through the patient's mouth and through the larynx?
No, look at here, the larynx, something, for example, a baby swallow something, a small ball,
Mm.
coming here, how you want to pass, okay?
So
You should cut here, and it is, in some of the movie, some of the movie is very useful for you. The doctor, the surgeon is going to explain for the patient everything. For example, you have problem, I'm going to remove the extra fluid around your line that make problem and pain for you. In this position, I am passing a needle in intercostal space to be able to access to the pleural cavity and remove the extra flow, okay? And about here also very soon, it is possible you will be out of in the street. Something happened and the patient, if any person have problem, it is possible if you never help to him or her, he get or she get died. So it is better if we know that the problem is something here that close the airway, we cut here, do the tracheostomy, but be careful. The age of the people, the age of the patient is important because in the adult, posterior to the manovarium, you know, the left brachiocephalic is passing. But in the baby, the form, the shape of the thorax is different from the adult. This left brachiocephalic vein is passing superior to manovarium. In this patient, in the baby, if you want to do the tracheostomy, it is possible because of breathing, he or she get died before about the problem of the air. So this age of the patient is important. Can we get your question?
Yes.
Now, the muscle in the larynx, it is very easy. The muscle of the in the larynx, all of the muscle are going to be innervated by inferior laryngeal nerve. You remember inferior laryngeal nerve? Left
Yes.
vagus nerve, right vagus nerve. Right vagus nerve has inferior laryngeal right side in the root of the neck. In the left side, the recurrent laryngeal in the left side arise from the left vagus inferior to arc of the aorta. So which of them is the content of superior mediastinum? Right recurrent laryngeal or left recurrent laryngeal? Left recurrent laryngeal, because left recurrent laryngeal is longer than the right. Right arise from the right vagus nerve at the root of the neck, but the left recurrent laryngeal arise from the left vagus inferior to arc of the aorta. So it is longer than the right side. In both sides, the recurrent laryngeal go up, ascend to be able to innervate the larynx. Most of the muscle of the larynx are going to be innervated by recurrent laryngeal nerve. One of the muscles that is visible here, you know this muscle. I told you it is post-row, cricoarytenoid muscle. Post-row, cricoarytenoid muscle. Do you remember the function of this muscle? Abduction. It is the only muscle in larynx that abduct the arytenoid, the vocal cord. Most of the muscle abduct the vocal cord. The only muscle that abduct is this muscle, posterior cricoarytenoid muscle. Where is the origin? The posterior surface of the lamina of cricoid cartilage. Where is the insertion? The posterior surface of the muscular process. About this muscle, muscle we can call transverse arytenoid muscle. Transverse arytenoid muscle. What do you think? This is the transverse arytenoid muscle. In one side is attached to lateral border of posterior surface of the arytenoid, and in the other side it is going to attach to lateral border of posterior surface
adduction?
of the
Adduction makes the larynx smaller.
makes the rim, makes the space between these
Vocal cords
vocal
smaller.
small. Look at here. Vocal cord are here near the midline, and vestibular cord are here, far from the midline. You have a space between the true vocal cord we call rima glottic. We call rima glottic. And a space between the vestibular cord we call rima vestibuli. Rima vestibuli is larger, or rima glottis is smaller. The same. That I explained for you. Now, when the rima glottis come near to each other, means the rima glottis is very narrow. When the arytenoid go abducted, the rima glottis go far from each other. It is going to get larger. Now, the transverse arytenoid muscle, the origin and insertion is visible. Both of them attached to posterior surface of arytenoid cartilage to the lateral border. What do you think? What's the function? Contract. What happened to the arytenoid muscle, to the arytenoid cartilage? They contract and take near to each other. What happened?
Adduction.
Adduction. They are going to do the adduction. What's the function? What's the innervation? Recurrent laryngeal nerve. Another muscle is visible here. We call oblique arytenoid muscle. The oblique arytenoid muscle. If you notice to oblique arytenoid muscle, this oblique arytenoid muscle is visible here, and this oblique arytenoid muscle in one side, it is going to attach to the muscular process of arytenoid cartilage, and in the other side, it is going to be continued in aryepiglottic form. So in one side, it is going to attach to the muscular process of arytenoid cartilage, and in the another side, it is going to be continued inside of the aryepiglottic form. This oblique arytenoid muscle is going to be innervated by the recurrent laryngeal, and the function is it is going to work such as the sphincter for the inlet. It is going to work such as the sphincter for the inlet. This fiber of the muscle, if contracted, the inlet is going to get narrow. Do you have any question? Which muscle I introduced to you here? The posterior cricoarytenoid. What's the function? Abduction. Transverse arytenoid, oblique arytenoid, adduction, and they are going to work such as a sphincter for the inlet. In this picture, another muscle is visible. We call the cricoarytenoid lateral. It is the posterior cricoarytenoid, it is the lateral cricoarytenoid. The posterior cricoarytenoid is going to attach to the posterior surface of the muscular process, but the lateral cricoarytenoid is going to attach to anteriorly. It is a muscle that rotates arytenoid medially, so the position, their function is adduction. These two, the function is opposite. What's the function of this muscle? Abduction. What's the function of the lateral cricoarytenoid? Adduction. Most of the muscle in the larynx are abductor. The only muscle that it is abductor is the posterior cricoarytenoid. Okay?
Yes.
Now, look at this picture. Another muscle is visible here. In this picture, I'm going to show you a muscle that we can call the thyroarytenoid muscle. Thyroarytenoid muscle. Anteriorly attached to the thyroid cartilage, posteriorly it is going to attach to the arytenoid. Some of the muscle fiber go superiorly, go to the aryepiglottic fold, this part. Some of the thyroarytenoid muscle fiber are going up to go inside of the aryepiglottic fold. This part of the aryepiglottic fold you can call thyroepiglottic muscle. Thyroepiglottic muscle belong to thyroarytenoid muscle. Only this part of the muscle go up, go toward to aryepiglottic fold. And deep to this muscle fiber. What's the name of this muscle? Thyroarytenoid muscle. Deep to this part of the muscle, you can find a muscle fiber that we can call the vocalis muscle. We can call vocalis muscle. Here, it is the true vocal ligament, and this muscle fiber we call vocal muscle. What's the function of the vocal muscle? They are going to relax the vocal cord. They are going to relax the vocal cord. They are going to shortening the vocal cord. Okay? Shortening the vocal cord, relax the vocal cord. Now, here, the last muscle in the larynx is visible here. It is the only muscle in the larynx that it is not going to be innervated by the recurrent laryngeal. What's the name of this muscle? Cricothyroid muscle. Cricothyroid muscle consists of two muscle fibers, oblique and straight. The oblique part are going to attach to inferior wall of the thyroid cartilage, and the straight part are going to attach to inferior border of the thyroid cartilage. What's the name of this muscle? Cricothyroid muscle. The only muscle that they are not going to be innervated by the recurrent laryngeal are the cricothyroid muscle. This muscle is going to be innervated by the lateral laryngeal nerve, by the external laryngeal nerve. This muscle is going to be innervated by the external laryngeal nerve. So you are in exam. I ask you, all of the following muscles are going to be innervated by the recurrent laryngeal nerve except cricothyroid muscle. Which nerve is responsible? External laryngeal nerve. External laryngeal nerve. Another extrinsic membrane or another extrinsic ligament is visible here between the first cartilage of the trachea and inferior border of the cricoid cartilage. Between the inferior border of the cricoid cartilage and the first cartilage of the trachea here, we have a ligament. This ligament we call tracheo or cricotracheal ligament. Cricotracheal ligament. It is an extrinsic ligament in the larynx. Now, in this picture, it is going to remember you that what happened, some of the muscle abduct and some of the muscle adduct. Look at here. The posterior cricoarytenoid muscle, the posterior cricoarytenoid muscle, they are going to abduct. the vocal cord. The other muscles are going to abduct, take near to the midline. This picture is going to remember you how the muscles are going to work. What is the function of the vocal muscle?
Stabilize.
Relax
Relax.
and shorten the ligament, vocal ligament. And here, what happened to the vocal ligament? They adduct. Which muscle is going to work? Transverse arytenoid. Yes? Now look at here to the posterior cricoarytenoid. They are going to adduct because they make lateral rotation, but most of them rotate medial. And the last slide about the larynx, that the anatomy of larynx finish is visible here. If you notice, you are going to look at to the look at here, open the mouth with the laryngoscope. You are going to look at to the structure of the larynx. If you notice, you can find that the vocal ligament and the vestibular ligament, all of them are visible. During the breathing, they are far from each other. During the strong breathing, deep inspiration, what happened? These are going to get, the inlet is going to get larger. So during the deep inspiration, during the normal inspiration, during you are speaking, okay, both ligaments of the vocal cord are coming near the midline. Here, what happened? Are you able to explain for me?
Here it is open during, I think,
The
since
three one
breathing.
below this is open. When it is open,
Breathing.
breathe.
Here it is closed, I think, due to some sort of swelling.
Swelling, but if you notice the inlet is open, so they are near the midline. You can imagine it is during the speaking. During the swelling, the inlet also closed.
Oh,
Okay?
because it looks closed.
Yes. And here, again, it is going to remember you that the vestibular fold closed. And in this picture, it is going to remember you that's how you can check and reach the trachea. Okay? For example, here you do the tracheotomy to be able to pass a tube through the trachea. The trachea is inferior to the larynx. Larynx is visible in proximal part of the trachea. And the last thing, please pay attention. About the artery, please remember the superior laryngeal artery and inferior laryngeal artery. The superior laryngeal artery are going to supply the larynx superiorly, and the inferior laryngeal artery is going to supply the larynx inferiorly. The superior laryngeal artery is a branch that belongs to the superior thyroid artery. And inferior thyroid artery has a branch that we call the inferior laryngeal artery. Superior laryngeal, inferior laryngeal, both of them belong to the superior thyroid artery and inferior thyroid artery. Okay? About the innervation, in this picture, we are going to look at to the right vagus nerve and the right recurrent laryngeal nerve. Left vagus nerve and the left recurrent laryngeal nerve. And this picture, and in this picture, you answer to this question. Which of the artery is passing through a foramen inside of the thyroid membrane? Thyroid membrane in each side has a foramen. An artery is passing here. What's the name of this artery?
Superior.
Superior laryngeal. It is a branch of the superior thyroid artery. And later, I am going in the other slide to explain about the nerve. Which nerve is passing through the foramen in thyroid membrane? Look at here. Here you are going to look at the vagus nerve. The vagus nerve has a superior laryngeal nerve. This superior laryngeal nerve is going to divide to two branches, to the internal and external laryngeal nerve. Again, the vagus nerve has so many branches. One of them we call superior laryngeal nerve. This superior laryngeal nerve divides to two branches, internal and external. The internal laryngeal nerve is passing through this foramen. So, what is the content of this foramen?
Superior.
Which nerve?
Superior.
Internal laryngeal nerve that belongs to superior laryngeal nerve. Which artery? Superior laryngeal artery that is arises from the superior thyroid artery. What about the external branch? The external laryngeal nerve is coming down to be able to innervate this muscle. The external laryngeal nerve is descending to be able to innervate this muscle. What's the name of this muscle? Ecothyroid muscle. So all of the muscle in larynx are going to be innervated by the recurrent laryngeal except cricothyroid. Which nerve is responsible to innervate the external branch from the superior laryngeal nerve? The internal laryngeal nerve is a sensory nerve. It is going to pass through this foramen to be able to innervate the sensory sensation part of the superior part of the larynx. I think everything finished. Please only be careful about it is a surface anatomy in the neck, and here I put this picture to help to you, and it is going to tell you something more. You can read by yourself.
Question about the tracheotomy.
Tracheotomy.
Yeah, it is done in this space here, right above the.
You should cut a transfer section in the neck, root of the neck.
Like between the two
supraesternal notch.
Between the clavicle, these two clavicles.
Supraesternal notch. Okay, superior to the manubrium. You cut here, remove all the teeth and access to the throat. Okay. What's the time?
10:30.
10:30.